Okay, sister, track your cycle. I
Mm.
don't care if you're trying to get pregnant. I don't care if your husband's had a vasectomy. I don't care. It doesn't matter. You have to track your cycle. You
Mhm.
have to track your cycle. And I want you to listen to me closely when I say this. You have to track your cycle. You have to do it. You have to know where you are, because if you're just bleeding and you're like, oh, I'm having my period, humpty bump, here I go in my life, you could die.
Yeah.
This is real. And if you're bleeding at a time other than when you're on your period, this is a problem that needs to be addressed. Now, granted, most of the time it's not a medical emergency, but if you have had a positive pregnancy test and you start having bleeding, you need to go get checked out, sister.
Okay, so
9
what do you
times out of 10, it's a subchorionic hemorrhage, which can be
Mhm.
treated with some progesterone and ALA. Or
Mhm.
you could even do nothing most of the time, and that's will resolve itself. But if you want to do something, there's great data behind that treatment.
Right.
Or it's a cervical, vaginal, irritation, or a polyp, or, there are
Mhm.
many non-life threatening things that can cause you to bleed. But pretty much
Yep.
all of them need some level of treatment. And so
Yeah.
you want to go get seen for that
Yep.
quickly,
Yep.
especially if you are early pregnancy and already have that positive test.
Yeah.
So going and getting your HCG drawn and looking at some imaging will rule out an ectopic, and these are very low risk interventions. I
Yep.
don't recommend that everybody just go get an ultrasound because the wind blows, but in this situation, it
Yep.
warrants investigation. So if
Yep.
you, first step is track your cycle. If you're bleeding at a time other than when you're on your period, red flag, get help. Second,
Yep.
if you are pregnant and you start bleeding for any reason, red flag, get help. If you are pregnant and you have pain, red flag, get help. Okay, these
Mhm.
things need to happen, and you need somebody who's going to investigate these things with you and make sure there's not an emergency.